Hi, it's Dr. Kulberg again at Anxiety Experts. Has your anxiety ever made you feel like you might be harmful to others? OCD really has a way of getting people stuck on thoughts about things that are contrary to their values and their character, such as if they might be a serial killer or a pedophile or some other unsavory character that is the furthest thing from their own value system. These are some of the most common thoughts that our most extreme anxiety disorder, called OCD, loves to get people stuck on. Harm thoughts are actually the most common theme that OCD loves to get people's brains stuck on, including thoughts that you may harm someone else, be inappropriate with someone, or even harm yourself. This would be very different from suicidal thoughts. Suicidal thoughts are thoughts where the person intends to harm themselves. But OCD can get a person stuck on some pretty gnarly thoughts that they might harm themselves, which again might be in direct conflict with their values or their character. Some of the most common harm thought type themes that anxiety, OCD will try and get people hooked on are things like, what if I'm a racist? What if I support sex trafficking? What if I'm a pedophile? What if I'm a rapist? What if I'm an axe murderer? All of these types of thoughts are things that may be completely the opposite of what the person who is stuck on the thought, even a small child, is interested in or wanting to do to anyone. Other themes might be things like, what if I jumped off a bridge? What if I drove my car into this center median here? Even though, again, the person has no desire to do such a thing. Or they may have had a slight desire in the past, or even a big desire in the past, to harm themselves, but now it's contrary to their values. They do not want to harm themselves. So sometimes the anxiety or OCD will get them stuck on that because now they're afraid they might come to that space again where they had been in the past, where they had wanted to harm themselves. The treatment for this is called exposure with response prevention. It is the #1 treatment for OCD, and we offer it here at Anxiety Experts. Depending on the severity of the person's symptoms, it could possibly need an intensive outpatient program, which is 3 hours, 3 days per week. But if the symptoms are less severe, they may be able to engage in once or twice per week outpatient therapy. This can be done virtually. The treatment is just as effective whether virtual or in person. So if you think you might have harm OCD, which can be very distressing, please call us here at Anxiety Experts. You don't deserve to live like that, fearing that you might be a bad person when you have a genetic disorder called OCD. Don't forget to like and subscribe here at Anxiety Experts. We'd love to show you more content on how to beat your anxiety or your OCD.